How did I get started in global health? It's interesting. I didn't really have anyone to tell me or suggest that I do it. It seems that it was innate in me. As a medical student, I worked after first year in a hospital in Lesbos, Greece, and after third year I worked in the Grenfell mission. Why did I do these things? I just felt that I needed to see a different kind of medicine outside the regular medical center, ivory tower type of place where I was being taught and working. So I stimulated myself to look around and see how medicine is practiced in different settings. And what I learned provided me with a strong background for being able to function even in the ivory tower type of settings. I'm fairly active in global health activities. I started a new medical school, the Medical School for International Health, which is in Beersheba, Israel. It's a collaboration between Ben Gurion University of the Negev and Columbia University Medical Center. We're now in our 12th year, and in this school we use an American type curriculum, 4 years in English, where students are trained to be doctors, to learn how to take care of sore throats and pneumonia. But there's a major program for inoculating, if you will, the attitudes, skills, and knowledge related to becoming a global health practitioner. How do you work with populations? How do you consider the economics of what you're doing? Disaster relief, water, sanitation, other sectors. I'm also president of the Global Health Education Consortium, a consortium of universities in North America and internationally who's geared towards building the international health workforce through increased education and training. At Columbia, I'm working hard to improve awareness of the opportunities that are available in global health, both by introducing it into the medical school curriculum, in organizing global health activities and opportunities for residents, and overall trying to integrate different sectors, both the medical student sector, the public health student sector, into understanding that they share many commonalities in what they need to achieve in terms of competencies and curricula, but there are differences in the different disciplines, so that a medical student may have to have some skills that are quite different than a public health practitioner in approaching global health problems. And I'm working both in the School of Public Health, in the College of Physicians and Surgeons, and actually downtown on the main campus, and trying to find policies for better educating and training Columbia students as global health future practitioners. So why is global health important for residency training, and what can be obtained from it? Again, I think that in terms of just the practice of medicine, many of the principles that are involved in global health involve treating populations not just in underserved countries or poor socioeconomic status countries, but many of the problems that exist there exist here in North America, so that there's an opportunity to see how some of the common problems that exist locally are paralleled by what's happening in very distant places. And other aspects are critically important here with the multitude of populations we have now in the United States and Canada and North America, dealing with people who are very different culturally in different settings provides a whole new set of skills, even practicing at times when you can't speak directly to the patient or the population in their own language, and how do you transmit messages, how do you transmit awareness of health problems and their solutions, requires a different kind of skill sets that are picked up quite often in global settings. So that I think that many of the things that are learned in practicing, in experiencing health away from your own community can be very helpful in building up your own expertise in your local community.